Assalamualaikum warahmatullahi wabarakatuh. Hi everyone. Let me introduce myself. My name is Ardelia Elvira Salsabila and I'm from University of Islam Negeri Maulana Malik Ibrahim Malang. Okay, I will explain about histopathology of ear, nasal, throat, and throat systems, as we can call as ENT system. In ENT system, we can find very much cases, but this time I will explain about allergic rhinitis, nasopharyngeal angiofibroma, retinoblastoma, and mucosal melanoma. Okay, first I will explain histopathology of allergic rhinitis. Okay, guys, you can see this picture, right? Okay, first we can see a papillary structures with the fibrofascular septum with hyperplasia cells, and then we can find chronic inflammatory cells, as we known as lymphocyte, with edematous trauma. And this is a thickening of the basement membrane. And what is this? This is a polypoid nasal mucosa. And this is a pseudostratified epithelium of the mucosa. Okay, next cases we are going to discuss about histopathology of nasopharyngeal angiofibroma. Okay, guys, here we are looking at two components. There are two components. The first components are these blood vessels, and they are very irregular, right? You can see some of them are large, some of them are small, some of them that have a thick wall, and some of them they have a thin wall, thick wall, and thin wall. Okay, they can be quite irregular with a staghorn appearance like this of the lumina. And in these blood vessels, we can find a prominent stroma like this, which is fibers, and that's why it is named fibroma. Collagens with the spindle shape, like spindle shapes, or angulated, or sometimes stellate shaped cells. Okay, next case is histopathology of retinoblastoma. Okay, guys, you can see this is necrotic cells with the pink pigment or pink colors. There are so many pink colors. And then this is a chronic inflammatory with a chronic inflammatory dark purple. Yeah, and this is perivascular tumor, very dark purple like this. And this is a blood vessel or vascular blood vessels. This is blood vessels. And okay, next, this is the last cases I will explain about histopathology of mucosal melanoma. Okay, guys, here we are looking of the tumor mass. We can recognize in the center's normal parenchyma at the tonsil. This is a tonsil, right? With the lymphoid tissues, follicle with shapely outline, germinal centers, with a pure cortical area, and with non-keratinized squamous epithelium on the surface. This is okay. So we are probably somewhere near the tonsil in the mouth. Here we have the mucosal glands, benign mucosal glands. Okay, here around these normal structures, and we have a populations of clearly malignant atypical epithelioid and spindle-shaped cells with the large nucleoli, with the slightly vesicular chromatin, and typically with a centrally located prominent nucleoli. This is large nucleoli with a prominent nucleoli. Around these cells, we have a deposition. Around of these cells, we have depositions of the dark brown pigment, as we known as melanin. Okay, when you see the melanin inside the clearly malignant tumors, you need to suspect of the melanoma. Okay, um, that is my presentations. Thank you for watching. Wassalamualaikum warahmatullahi wabarakatuh.